allowed to only get parents' insurance. And as more and more kids go to college, and with that more and more go to grad school, law school, medical school, we need to make sure that kids are taken care of and have health insurance. So with that, I'll introduce the governor, who I do proudly, as he is a leader in the country for healthcare policy and making it so it's affordable and quality for all of us. So,
thank you, Kyle. Thank you very much. Well, thank you very much, Kyle, for sharing your story with us here today. With the help and cooperation of the legislature in a bipartisan way, hopefully that will change. We'll be able to address your concerns starting July 1 of this year. That's when most of the bills will take effect that we get passed into law. So we really will keep you in our thoughts as we move forward. Kyle is an example of there are literally tens of thousands of Iowans out there that have similar stories, and I think it's helpful for public policy makers to hear them directly, and I believe as a result that type of testimonial, if you will, could serve as inspiration for all of us as we work on what I think is very important legislation. I also want to thank the Bipartisan Legislative Commission on Affordable Health Care, led by Senator Jack Hatch and Representative Ro Faggy, for their hard work on this issue. I know that Ro is with us this morning as well, and we appreciate them moving quickly during the interim last year to put some really positive thoughts and ideas on the table in terms of increasing health care. We will continue to work with this commission. We have other members of the commission that are with us this morning, and we will continue to work on their recommendations. Simply put, I believe access to health care is a right for all Iowans. There was a great debate on this issue during the caucuses, and I'm pleased to see the national debate on this critical issue as well. While I'm optimistic we will eventually see progress in Washington on this issue over the coming years, I believe there are some things we can do at the state level right away to make it easier for Iowa families to get the quality health care that they deserve. I have three main goals, which are ambitious but achievable if we work together in a bipartisan way. Number one, we must focus on increasing access to quality health care. Number two, we must lower health care costs while improving health quality. Number three, we must work towards a goal of giving all Iowans the same type of affordable, accessible health care that elected officials get. To my first goal of expanding access, in my condition of the state address, I pledge to expand health care for the most vulnerable Iowans, our uninsured children. Since I took office in January of 2007, I'm proud of the fact that we have expanded access to thousands of Iowa kids. And this year we will open Hawkeye to 7,500 more eligible children. We have also launched an aggressive marketing campaign to encourage all Iowa families to visit hawk.i.org or call 1-800-257-8563 to determine whether or not their children are eligible for this state-sponsored program. But those are just the first steps. Today, I'm rolling out 4 additional specific proposals to expand healthcare access and reduce healthcare costs. First, let's streamline the way that medical records are kept. The key to measuring both quality and cost of service is a one-stop shop for healthcare providers to make it easier for them to store and exchange medical information. So I'm proposing legislation which will create the Iowa Electronic Medical Records Council, which will develop a statewide information plan by January of 2009. Second, it's time to eliminate exclusions and waiting periods for people like Kyle who are transferring from group health plans to individual plans. Under current law, people who make the move from a group insurance plan to an individual insurance plan are often required to wait for their coverage to begin. And then there's the matter of pre-existing conditions, which we've just heard about. If you have group insurance and a medical condition develops, I believe that that condition should not disqualify you from the same level of coverage you previously had if you change your provider. It's a matter of fairness. And it's also a matter of good public health. Individuals should not lose their coverage when they need it the most. Third, we must do whatever we can to keep Iowa's young people insured. As I mentioned, we have taken great steps in bringing health care to our children with the Hawkeye and S-CHIP program. But what about unmarried individuals over the age of 18 years old? Well, I believe it's common sense to support our young adults and their families. So I've proposed that parents be allowed to cover their adult children up to age 25 on a family plan. As young people find their way and become productive members of our communities and our workforce, they deserve the security and the stability of a good health care plan. Fourth, and finally, we must recognize that there have been some fair concerns raised recently about sudden and substantial long-term care rate increases for Iowa consumers. It is difficult, especially for seniors, for those on fixed income, to budget accordingly when we have these drastic rate increases. So I propose we cap long-term care insurance rates increases at 12% per year to protect Iowa policyholders. This will provide relief by limiting drastic rate increases and will help people budget for the future as they make their health care decisions. With these proposals, we are taking the steps in what I believe will ensure affordable, accessible health care for every Iowan, young and old. I look forward to working with Republicans and Democrats and consumer groups and other stakeholders to turn these goals into action. Iowans have waited a long time for action on this issue, and I believe it's time for us to deliver for them. We are on track to meet our goal of making Iowa the first state in the country to cover every child. And we are very close to achieving my goal of making sure that every Iowan has the same health care that elected officials get. 94% of children are insured currently, and almost 90% of adults are currently covered. So we don't have too far to go. And I think it's a worthy goal to strive to be the first in the nation in both of these categories. But our work is not done. As I've outlined, we've got some important steps we can take in the next couple of months to move forward and achieve these goals and these priorities for the people of Iowa. Thank you very much.